What's up guys, IFBB Pro Morgan McDonald here for IFBB AMA. In this video, we're talking about what blood work you should get done to make sure you're staying healthy. If you haven't seen it, check out my steroid horror story video to find out exactly why you should be getting your blood work checked on the regular. So let's get into it guys. So a lot of people ask me all the time, like, hey, I'm getting my blood work done, like what should I get checked, right? So I wanna run through that list today. One thing that you should always be checking constantly as a bodybuilder, if you're enhanced especially, is your blood pressure, right? If you're running high blood pressure for prolonged periods of time, it can have, really negative effects on your cardiovascular system, your heart. Having increased blood pressure for long periods of time can cause left ventricle growth, right? Because obviously blood pressure is high, heart's working harder. If you're taking anabolics and things like that. Creatinine is a byproduct of muscle protein breakdown. So you're training, right? Your body's breaking down muscle. Creatinine is a byproduct of that. Your kidneys have to filter that. If you have really high creatinine in your blood, that means your kidneys are not doing a good job of filtering that. And that's how they measure your eGFR, which is going to be your kidney filtration rate, essentially, how well your kidneys are filtrating the creatinine, right? If this number is really low, like below 60, that means your kidney health is declining and you're kind of outside of normal ranges. So that's when you're going to want to address that, see if you're running high blood pressure. If you are, fix it. It will really help that issue and it'll help your kidneys recover and go back to functioning normally. Okay, so moving on to the actual blood work itself. So usually the first thing that you're going to see there would be a complete blood count. So that's going to be your hemoglobin, your hematocrit, your RBC, essentially your blood volume. So this kind of does circle back to the blood pressure. Obviously, if your hemoglobin and these things are super high, you probably have high blood pressure. So again, doing the blood dump, taking the astragalus to protect your kidneys, a commonly prescribed blood pressure medication. Guys usually take anywhere from like 40 to 120 milligrams a day, depending on how bad you need it, how big you are, all these contributing factors. So telmisartan is great because it will bring your blood pressure down in the healthy ranges, depending on obviously your dosage. Also, NAC is a fantastic supplement. That's going to help majorly with keeping these numbers in check. And also take your fish oil, right? Fish oil, making sure you're getting the amount of omega-3s that you should get. So next is going to be two of these markers correlate obviously. So your fasted blood glucose levels and your A1C, which is going to be the 3-month average of your morning fasted blood glucose levels. So obviously the reason why these numbers are so important, it's going to let you know if you're running high blood pressure running high blood sugar for long periods of time. This is again pretty common, especially for bodybuilders in the off season, taking GH. Obviously a big supplement for us bodybuilders to take for getting bigger and recovering, but it does make you insulin resistant. So if you're running, GH, morning and night, and you're not taking anything to help counteract that insulin resistance, it's going to run your blood sugar up. And if you have this happen for a prolonged period of time, it's going to force your pancreas to be constantly working to produce insulin to try to get it down. And after a while, your pancreas can stop functioning like it should, and you can develop diabetes. So a way that we can, help with this is to, if necessary, lower GH or take it out. But not a lot of guys are willing to do that. So we'll take metformin, which is a medication for, diabetics or pre-diabetics to help with the production of insulin and staying more insulin sensitive. So next is going to be liver. So liver, of course, something we need to keep an eye on, right? Your liver is going to be affected, by the things that we take. So how we're going to measure our liver, most commonly ALT and albumin, right? So if you have high ALT levels, ALT is an enzyme that essentially helps your body, your liver break down like protein, right? Last one, guys, we're going to talk about your hormones, of course, right? So sometimes it's actually hard to get checked if you're just like getting blood work through like your general practitioner. I think the most important time to probably get your hormones checked is when you're like in between cycles, when you're on your cruise phases, TRT phases. TRT these days is like crazy, like what guys try to do in between cycles and say that they're like cruising or whatever. As far as how often should you get blood work done, I think for me, I'll definitely get it done before I start a cycle, because you're going to want to make sure that everything's in check before you do a 16 or 20 week blast. Like you don't want to be going into a big blast not knowing where things are at. And then definitely like after you're done a cycle too, right? To come, do your show or do your off-season blast, give your body 2 weeks, and then get blood work done just to see where things are at post-cycle, just to kind of see what damage, if any, was done and what you need to use the following health phase to correct, right? So I think if in total you're getting your blood work done 4 times a year, I think that's very responsible. That would definitely keep you up to date on if there's anything happening. You'll be able to track those trends I was talking about. And overall, that's what's going to keep you healthy and let you know if you can continue bodybuilding and stay safe and not be putting yourself at risk, right? Hope this video helps, guys. We'll catch you on the next one.